Take two. This is Marty Mueller discussing payment for palliative care services, barriers to care due to problems with reimbursement. Um, Basically, I'm just going to review the major insurance plans and some of the downsides of Medicare, Medicaid, and private insurance, not in that order, of course. Medicare. This I took from the Milbank Quarterly article, which you all probably have read. But Medicare Part A doesn't have, it does cover some hospice services, but it does not have any care for palliative care. But you can get 100% of home health services paid for. So you could possibly have someone with a life-limiting illness who needs pain management and have home health see them and even contract with hospice, even if the patient is getting curative treatment for pain management. Medicare B, they do have specific codes for hospice and palliative care under physician services. For the patient, it is a 20% copay after their deductible. Limitations on the care is, of course, you have to be able to afford the deductible and the copay along with the rest of your medical services. Other disadvantages are that any nurse practitioner would need to have a collaborating physician or supervising physician in order to be able to bill. But there is more CPT codes to add time and services for reimbursement for such services as advanced care planning, prognostication. So there is more reimbursement potential there. Also, social workers can bill under Medicare Part B. Medicare Part C, that is the Medicare Advantage plans, which is a cooperation between private insurers and Medicare. And that would depend on what state you're in and what a private insurer has to offer for that plan. Just as an aside, in Wyoming, there are no Medicare Advantage plans, so there is no Medicare Part C available in the state of Wyoming. I'm just mentioning VA hospitals and VA clinics and facilities have access to palliative care consult teams to manage those type of patients with a serious illness and which will have the potential to shorten their life. I'd like to cover private insurance plans next, and I'm referring to a website by CAPC.org called Payer Provider Partnerships in Improving Care for People with Serious Illness Through Innovation. I want to mention four private payers and some of the creative plans they are doing to facilitate palliative care. The first is Aetna. They call it the Compassionate Care Program, and they reduce their costs for Medicare Advantage plan Medicare Advantage plan members. Okay, next is Excellus, EXCELLUS, Blue Cross Blue Shield in upstate New York. They have enhanced payment plans for clinicians who have completed MOLST or POLST trainings. Third insurer is Highmark, which serves West Virginia, Delaware, and Pennsylvania. They offer extensive palliative care coverage for inpatient palliative care and community delivered palliative care. One of the really exciting ones is Blue Cross Blue Shield of Massachusetts. They offered an incentive payment program, I believe, as a pilot program. And what they found is that palliative care consultations rates tripled when they offered the incentive payment plan. So that was an advantage to the patients under that. Under Medicaid, there is no use of palliative care terminology. Palliative care can be delivered under codes for home visits from a physician, nurse practitioner, or social worker. That information I got from starttheconversationvermont.org. So as you can see that there's not a lot of funding for palliative care specifically, and that there are restrictions of it, and it often for nurse practitioners, it requires that they have a physician working with them for billing purposes. I look forward to your questions online. Thank you.